The third subtype of fibromyalgia I'd like to talk about is nutritional deficiency fibromyalgia. It's very, very interesting. There's a vitamin D expert named Michael Halleck. He's in Boston. And he's written a lot about vitamin D. And he has estimated that 40% of the US population is deficient in vitamin D. But you're really deficient in vitamin D when your vitamin D level is 20 or less. Optimal levels of vitamin D are really 50 to 100. So what happens if you're deficient in vitamin D? Well, the old deficiency disease paradigm defined the recommended daily allowance of vitamins based on what is the lowest amount that will prevent a deficiency disease. So we're talking about beriberi, scurvy, it's vitamin C, and in case of vitamin D, rickets, where the bones are like soft. And with kids, they'll actually be bowed legs because of the low vitamin D level. Because vitamin D is necessary for getting the calcium into the bones. But that's not the optimal level of vitamin D. So most labs define the reference range of vitamin D to be 30 to 100. So if you have 30 or 31 or 35, it's considered to be adequate. But in functional medicine circles, we know that it is not optimal. You need a level of at least 50 to be optimal. And more is usually better. So in the case of this patient, I did a vitamin D level. She had fibromyalgia, and it was 14, which is really, really low. So what can happen if you have a low level of vitamin D? Well, you can have rickets if you're a kid. What happens if you're an adult? The phenomenon is called osteomalacia. And osteomalacia is defined as bone and muscle pain. So there you go. There's an actual state of low vitamin D level, which manifests itself as bone and muscle pain, which of course is going to look like fibromyalgia. So they did a study in Saudi Arabia with women, and they found extremely low vitamin D levels. Not surprising, since vitamin D is the sunshine vitamin, and all these women were wearing burqas, so there was no exposure to the sun. And they gave them high doses of vitamin D, and a large number of them improved dramatically from the vitamin D. So this is what I call nutritional deficiency fibromyalgia. And there are other nutrients that if you're low in them can cause pain besides vitamin D.